Sign-ups for Obamacare health plans are actually running more than 45% ahead of last year's pace, despite less funding for promotion or general support from the administration. The Centers for Medicare and Medicaid Services says nearly 1.5 million consumers had picked a plan by last Saturday, compared to just more than 1 million during the early days of open enrollment last year. So what would actually happen if Senate Republicans are able to get rid of the Obamacare individual mandate? Correspondent Peter Doocy takes a look.
Committee will come to order.
Senate Republicans are about to try to do something they couldn't this summer: repeal Obamacare's individual mandate. And Democrats are furious.
I can't believe, after the American people have risen up and said no twice, that they would do this again.
The motion is not agreed to.
In July, the Senate's attempt to gut Obamacare and the mandate that forces people to pay a fine if they don't have insurance fell flat. So now, 4 months later, they're attaching a repeal to their tax bill.
This is a narrow surgical strike. It says we're not going to keep punishing low-income people who can't afford these outrageously expensive policies that don't serve their needs.
We're probably going to be due for a CAT scan and a couple of treatments.
If the individual mandate vanishes and Americans can choose not to pay for health insurance, the CBO projects the number of people without coverage will rise by 4 million in the next 2 years, then 13 million over 10 years. Insurance premiums would also rise an average of 10% a year, but the deficit would drop by $338 billion.
They are cutting people's health care to make sure they can make corporate taxes cheaper for everybody forever.
This morning, things got heated at a typically dry Finance Committee hearing when Pennsylvania Senator Bob Casey protested the proposed Obamacare changes.
Ripping health care from people at the same time you're jacking up their taxes.
Senator, your time is up.
Gladly yield.
But some Republicans argue the premium hike that would follow a repeal of the individual mandate beats the alternative.
I'm listening to my colleagues on the other side of the aisle complain about a 10% increase. Nevada will experience a 38% increase under the ACA next year.
Other Republicans are trying to highlight the freedom this 2-for-1 tax bill and mandate repeal would bring Americans worried about their health care.
People having to pay a fine will stop paying the fine to buy crappy insurance.
Republicans say that because the highest percentage of people who pay a penalty, so they don't have to pay a premium, earn less than $50,000 a year, then getting rid of the individual mandate would be good for low-income Americans. And today, the Senate Majority Whip, John Cornyn, said he's optimistic they've got the votes to do it. Brett?
Peter Doocy live up on Capitol Hill. Peter, thank you.